Okay, hello, my name is Tanika Finney. I have chosen the case study entitled Nursing and Professionalism. This is case study number 1.1. It's located on page 47 of our text, Ethics Across the Professions. In this case study, the conflict arises between two nurses who differ in opinion as to whether or not nurses should be working off the clock. That's doing your nursing duties for free, not getting paid for them. Now, I chose this case study because I've actually had some experience with working off the clock myself. Um, the budget didn't allow for a certain amount of labor hours, so I had to clock out, but I still wanted to complete some things for my patients. So this very thing has happened to me in the past. Okay, going on with the case study, our first nurse by the name of Diane takes the position that she is exemplifying professionalism and is attaining much more than a paycheck when she chooses to use her personal time to work for free for the betterment of the patients, to help out with processes that'll help us take care of patients better. Um, while the other nurse, whose name is Arlene, feels as if Diane is setting the profession of nursing back by not acknowledging that our work is valuable and worthy enough to be compensated just as other professionals are compensated, like doctors, physical therapists, social workers, things like that. There are three questions that I'd like to address uh, with this case study. Number one is very simply, is it legal? Is it legal for nurses to be working off the clock? Um, we'll take a look at that. We'll refer to the Department of Labor as to that answer. Number two is Arlene's position in line with that of the American Nurses Association's Code of Ethics? Um, the American Nurses Association's Code of Ethics is what all nurses go by as their code of ethics. And number three is, has Arlene failed to understand the proper role of altruism in professionalism? Uh, I'm going to go ahead and get started with the question of altruism. Now, altruism is concern for the well-being and welfare of others. As it relates to nursing, we portray altruism by advocating for the patient, putting the patient's best interest first. And generally, altruism is exemplified by a selfless service on behalf of others. Most nurses get into the field of nursing because they want to help people, because they want to care for others. And this can be considered selfless, but at the same time, we're compensated for what we do. Um, Nursing is a valuable service and deserves to be compensated all the same. Looking at it from Arlene's point of view could be considered less than altruistic because she does consider herself in the equation. To whereas Diane is more so focusing on the patient and has less concern in regard for her own compensation and what she's getting out of it. Now let's look at the Nursing Code of Ethics. Specifically under provision 2, number 2.1 through 2.3, it states that the interest of the patient are the primary concern of the nurse, and that the nurse's foremost duty for the patient is to make decisions based on safety, comfort, and best interest of the patient and the patient's plan of care. In this instance, on its face, this seems to support Diane's view by looking directly at those provisions in the Nursing Code of Ethics. Arlene has a point that implies that Diane's working for free. It could increase nurse burnout. It could cause an expectation to be placed on other nurses to work for free, to be expected to work for free. And it could also take away the realistic view of what it takes to take care of a patient. If nurses are constantly working for free and constantly clocking out, then the people who are actually looking at the budget are not seeing what is actually necessary to take care of a patient on a daily basis. So that's how she's looking at it, saying that this could hurt the profession itself and ultimately hurt patient care in the process. Now, the last question is it legal? Is it even legal for nurses to be working for free? In looking this question up under the Department of Labor, nursing employees that are considered hourly, meaning they clock in and clock out and they're paid by the hour, they're not salary. It's not legal. As an hourly employee, you're not supposed to be working off the clock. You are supposed to be paid at the very least minimum wage for hours that you're still working, and any hours above 40 hours a week or above 80 hours per pay period, you should be receiving overtime, an overtime rate. There are some nurses that fall into this category, nurses that are salaried, that can work over their 80 hours and not be compensated, but those nurses are in administrative positions. Those nurses are in managerial positions, so they would be considered salary employees, and it would be legal for them to work for free. Now, personally, I have been an hourly employee, and I've also been a salaried employee. I tend to agree with Arlene's viewpoint on it because I've been a nurse for well over 10 years, and I started out really gung-ho, just like Diane did. I was willing to go above and beyond for all the patients. I just wanted to see good be done, and I just wanted to help the patients get to the best point on the healthcare spectrum that they could get, and whatever I could do to aid in that, that's what I wanted to do. As the years go on, working for free does have some wear and tear on you. It also does increase nurse burnout. I've seen it happen. Nurses that are continually having to clock out to finish charting, clock out and come back in and take care of patients. That increases burnout, which increases nurse turnover, which does not help us improve the state of healthcare as a whole. So I do believe looking at it from Diane's point of view is kind of a short-sighted point of view, and it's not having you to look at the whole picture. And I agree with Arlene in that in the long term, working for free would hurt the profession and the healthcare process as a whole. Thank you.